I'm good. I'm doing well. In the crisis here.
In the crisis
Pandemic.
mode.
In the pandemic. It's not referred to as a crisis as of yet, I don't think.
I think it is a crisis.
I mean, it's definitely a crisis colloquially, right? But I don't know if we've officially, as government officials, have referred to it as a crisis yet.
So tell me what's happening. Yeah, in the Queens. You work for the Queens Borough president, and
I do. So my name is Brent Weitzberg. I'm the Director of Health and Human Services and Seniors for the Queens Borough president. So I'm her policy guy related to everything in the borough that circles around health, human services, hospitals, our hospital systems, our senior centers, our homeless population. I do some work on domestic violence, child advocacy, food insecurity, as well as animal advocacy, because the city operates 2 animal shelters through ACC, which is the city animal shelter, basically. And I oversee the policy related to our vulnerable animals as well. They're going to be building a facility in Queens in 2022, I believe it's slated to open. So I guess the best way to describe my role is I'm the person that gets funneled all the policy work related to vulnerable populations. So I focus on all vulnerable populations, except I don't do anything with housing. Housing is under someone else.
mm-hmm. But these vulnerable populations, that's the populations that we're talking about when it comes to this pandemic.
Definitely, right? So we definitely want to look out. We want to see how our hospitals are managing everything. We want to see how they're managing ER visits and overflow. And, we obviously don't have any oversight to that. But the goal of our office to just be in constant communication and know what's happening in our borough. So the city operates 2, I'll call it public hospitals. For lack of a better term. One is H&H Elmhurst and one is H&H Queens, and they are experiencing this from a city perspective, being part of the city's free healthcare network. So those are the folks that are going to ERs. So right now, the city's directive is we want people, and this is the city talking, right? This, I won't say this is exactly from our office, but this is what the city is funneling down. They want people to stay at home. We want to do something called flattening the curve. So you flatten the curve, basically that means people stay away from each other. So the virus doesn't spread. The virus spreads from everything that we've been told right now. It spreads through saliva. And it spreads through droplets. So that's why there have been changes to the CDC guidelines as to the type of masks that you're allowed to wear in a medical facility, and why we are so keen on social distancing right now. And we also care about our seniors, right? The borough of Queens has over 300,000 seniors. We have a very fast growing senior population. And now, with this pandemic, the definition of senior even gets extended broader. So now, under this pandemic, the original guideline was individuals 50 and older. When we talk about seniors in the city, we're usually talking about folks 62 and older, 65 and older. But now this pandemic has just spread it out more. So we want to be mindful of our vulnerable populations that are visiting healthcare facilities and also our seniors.
So what are you working on now that we're working from home?
So a lot, actually. So when we work from home, so Borough Hall is really good in the way that they set up, how do you call it? How they'll set up like remote work, right? So basically what they're doing is I have access to my work files. I have all my work files, my work computer, and I can access it through a system on my personal device that is protected. So I have access to everything that I need. We are responsive to constituent inquiries, responsive to phone calls. I'm coordinating with our food pantries at our senior centers to make sure that food is being dispersed. I'm coordinating with hospital systems to make sure that there's an open line of discussion there in case they need anything from us. Actually, the borough president came out with a press release this morning. This is Sunday, so a press release came out this morning in partnership with Queens College. Personal protective gear, so like masks, gloves, blouses, like medical blouses. Queens College had a stockpile of that in their labs. For when their students, their science and math students, are using this stuff. And they said, well, our school is closed. We don't need to use it right now. So they had compiled all these materials, and the Office of Emergency Management is going to be taking them and funneling it down.
That's great.
So we're working on a lot. I can't take credit for that. That was not me, but I'm proud of my office.
You're